So the concept between free water clearance is very simple. You have to understand that what is free water. Free water is actually solute free water. That's about usually whenever we are applying suppose your loop diuretics or anything, it is sodium that is drawing all the water with it. But free water is something that is without this sodium, that is remaining in excess of this sodium or other solutes. Now we can imagine it like where does carbonic free water will be the water that is coming out that is free of all solutes. So if there is a bit of solute, it will be negative free water clearance. If there is no solute, it will be more positive free water clearance. And this free water, if it comes out, that is positive free water. If this free water is getting reabsorbed again in the collecting duct, it is called negative free water. So we have to understand that in PCT, in case of carbonic anhydrase inhibitors, here sodium and water are reabsorbed. So mainly this sodium and water are reabsorbed, and what happens in case of carbonic anhydrase inhibitors, this thing is stopping, so sodium and water will be getting excreted. So sodium and water getting excreted, it comes this way, and in the thick ascending loop this remaining sodium will get absorbed irrespective of the water, because thick ascending loop is impermeable to water. So hereby only water will remain, and that will go out as the positive free water clearance. So only drug that increases positive free water clearance is carbonic anhydrase inhibitors. On the other hand, if you see what is happening in your loop diuretics, loops actually they halt this thick ascending loop of Henle, so there will be no sodium reabsorption. So this remaining water that will come out won't be free water, so your positive free water clearance will decrease. Other than that, what your loops do is that they decrease the medullary osmolarity. So this medullary osmolarity is the thing that is important for your reabsorption of water from your collecting duct. So when this medullary osmolarity gets hindered by this loop diuretics or by the loop diuretics, then the negative free water clearance also decreases. Now when we are looking at thiazides, it is also having the same mechanism. Thiazides act on the DCT to absorb sodium and chloride. So sodium chloride reabsorption, they inhibit that, and that's why sodium comes into your lumen, and as a result the net positive free water decreases. And then when we are coming to the last point, that what is maintaining this negative free water clearance. Negative free water clearance is the water that is coming back into the medullary interstitium from your collecting duct, and that is mainly regulated by your medullary interstitial osmolarity. So that is regulated by a vasopressin. So that negative free water can also be inhibited by your can decrease by your loop diuretics, as we explained. Other than that, it can also be affected by your vasopressin. Medullary osmolarity will be increased by vasopressin because it is antidiuretic hormone. When antidiuretic hormone does not act, your negative free water clearance will also decrease. So the summary chart of all this will be that carbonic anhydrase inhibitors like acetazolamide will increase your positive free water clearance. Loops and thiazides both will decrease your positive free water clearance. Loops in addition will also decrease your negative free water clearance by reducing your medullary osmolarity. If they ask you, is there any other drug that decreases negative free water clearance, then that is Vaptans. And another thing you have to remember, what is free water clearance? Free water clearance is solute free water. If it is 0, then it is actually that solute and water are equal. If it is positive, then it is mainly indicative of a dilute urine. If it is negative, then it is of course a concentrated urine. So that is what is free water clearance.